Are you totally exhausted from planning your entire day around bathroom breaks? You know the feeling. Walking into a new place and immediately scanning the room to make sure you know exactly where the nearest restroom is. For millions of people dealing with the relentless urgency of an overactive bladder, this isn't just some minor inconvenience. It is a daily, exhausting reality that dictates where you can go, what you can do, and ultimately, how you live your life.
Welcome to this explainer. Today, we're taking a heavily data-driven look into a pretty surprising urological treatment. We're going to explore the clinical realities, the actual medical science, and the true patient outcomes of using Botox for overactive bladder.
Okay, let's dive into this. Here is our roadmap for today. We'll start with the overactive bladder struggle, look at Botox as a surprising solution, step right inside the procedure, review the real quality of life results, and then finish up with the important risks and caveats.
Part 1. The overactive bladder struggle, the daily burden.
As a lot of us already know, overactive bladder, or OAB, is not just about frequency. It's a chronic, irrepressible urge to urinate that completely hijacks the patient's routine. It derails your days and constantly interrupts your sleep.
It's honestly a logistical nightmare. Patients are forced to plan their entire days around bathroom breaks, living with this constant baseline anxiety of locating the nearest restroom. It means frequently excusing yourself from important meetings or missing out on social events. It creates a massive, silent burden on everyday quality of life. Section 2. Botox. A surprising solution, way beyond the cosmetic. So the crucial point here is understanding exactly what this drug is clinically approved to treat in urology. British guidelines make a very strict distinction. Botox does not treat stress urinary incontinence, the leakage you might get from coughing, laughing, or exercising. Instead, it's designed specifically for overactive bladder, targeting that severe underlying urgency and frequency. Now you might be wondering, how does a famous wrinkle treatment actually help your bladder? Well, the mechanism is remarkably simple. Botox prevents the bladder muscle from contracting or squeezing too aggressively. By relaxing this severely cramped muscle, the bladder's actual storage capacity increases. You can simply hold on better. And that urgency-related leakage is often significantly reduced or even entirely resolved. Moving right along to Section 3. Inside the Botox procedure, step by step. To give you the absolute most accurate picture of this intervention, we are relying directly on the evidence-based surgical guidelines provided by the British Association of Urological Surgeons, or BAUS. Let's look at how this builds. The physical steps are super straightforward and targeted. Step 1, the surgeon carefully passes a specialized telescope into the bladder through the urethra. Then, Step 2, they administer several highly precise injections of botulinum toxin A directly into the bladder wall muscle. This delivers the medication exactly where it's needed most. If you found this information helpful, please like and subscribe for more evidence-based content on urology. All right, Section 4, Real Quality of Life Results, the Data Dive. Let's look at a peer-reviewed Polish gynecological study that tracked 50 women suffering from severe overactive bladder. But here is the critical context you need to know. These patients were refractory to oral medications. That means standard treatments like daily anticholinergic pills had entirely failed them. They were literally out of options before receiving these Botox injections.
And this brilliantly illustrates the real-world impact. Looking at subjective quality of life questionnaires designed to measure how bad the urinary symptoms were, we see a massive drop in symptom scores from the baseline to 3 months post-injection. Crucially, those lower, better scores are maintained at the 6-month mark. Clinically speaking, this is a highly significant improvement with a p-value of less than 0.001. For patients who had failed standard therapies, this genuinely restored their daily quality of life. It's a real game changer. Finally, Section 5, Understanding Risks and Caveats, Informed Consent.
Of course, any surgical intervention comes with rules and limitations. The British Association of Urological Surgeons explicitly outlines several critical ones. First and foremost, botulinum toxin A absolutely cannot be used if you are pregnant or even planning a pregnancy, because the side effects on an unborn fetus are largely unknown. Additionally, there are regulatory rules to consider. In the UK, it is the patient's responsibility to ensure they are fit to drive after surgery. If your ability to drive is likely to be affected for more than 3 months, you are legally required to notify the DVLA and check with your insurance company. Furthermore, we have a very specific, serious risk to examine for patients with spinal cord injuries.
As spinal cord injury BC notes, and I quote, "Considering the high incidence of silent episodes of autonomic dysreflexia during the urological procedures, it is recommended that monitoring of cardiovascular parameters be routinely performed." End quote.
To safely manage this specific risk, the clinical best practice is totally clear and essential. Routine blood pressure monitoring absolutely must be performed during the Botox injection procedure. This allows the medical staff to catch any silent spikes in blood pressure that are indicative of autonomic dysreflexia. It ensures that even high-risk patients can undergo the procedure safely with the right cardiovascular oversight.
Which brings us to our final thought today. We've seen how a condition that completely dictates a patient's schedule can be intercepted by a surprising, clinically validated mechanism. Looking at the massive drops in those symptom scores for patients who had otherwise lost hope, could relaxing your bladder be the key to finally reclaiming your time? Thank you so much for exploring the data and the clinical realities of this fascinating treatment with us.